Hi, this is Caitlin and Daniela, and we're going to be going over some type 2 diabetes. Okay, so type 2 diabetes is a disease where the body either doesn't produce enough insulin or can't properly use the insulin it produces, leading to high blood sugar levels. This is often due to insulin resistance, where cells become less responsive to insulin, and the pancreas may eventually struggle to produce enough insulin to compensate. Over time, this can cause various health problems, including heart disease, kidney disease, and nerve damage. Here are some symptoms with type 2 diabetes. Symptoms can include increased thirst and urination, excessive hunger, fatigue, blurred vision, and slow healing sores, and also frequent infections. Many people with type 2 diabetes have no noticeable symptoms, especially in the early ages, and may only discover that they have this disease when they experience complications. Some complications of type 2 diabetes include long-term high blood sugar levels that can damage the blood vessels and nerves throughout the body, leading to various complications. These complications include heart disease, kidney disease, stroke, nerve damage, eye damage, and skin problems. Now, Daniela is going to go over some of the treatment and diagnostics of type 2 diabetes.
Okay. My name is Daniela. Major diagnostic tests for type 2 diabetes include the A1C test, fasting plasma glucose test, and oral glucose tolerance test. A random plasma glucose test may also be used in the presence of classic diabetes symptoms. The A1C test is a blood test that measures your average blood sugar levels over the past 2 to 3 months. An A1C level of 6.5% or higher is indicative of diabetes. Fasting plasma glucose test measures your blood sugar after an overnight fast at least 8 hours. A fasting plasma glucose level of 126 or higher is diagnostic for diabetes. The oral glucose tolerance test is a test that involves drinking a sugary drink and having your blood sugar levels measured at intervals, usually after 2 hours. A blood sugar level of 200 milligrams or higher after 2 hours of drinking the glucose solution indicates diabetes. Random plasma glucose test. This test can be done at any time regardless of when you last ate. A random plasma glucose of 200 milligrams or higher, along with symptoms of diabetes like excessive thirst or frequent urination, is considered diagnostic for diabetes. Common medications and treatments for type 2 diabetes include lifestyle changes, oral medications, and injectable medications like insulin and GLP-1 receptor agonists. Lifestyle changes like diet and exercise are often the first step, followed by oral medications like metformin, sulfonylureas, and others that help regulate blood sugar. Injectable medications, including insulin and GLP-1 receptor agonists, may be necessary when oral medications are not sufficient. The oral medications can be metformin, sulfonylureas, thiazolidinides, DPP-4 inhibitors, SGLT2 inhibitors, alpha glucosidase inhibitors. Injectable medications are insulin, GLP-1 receptor agonists. Other treatments are bariatric surgery, may be an option for some individuals with severe obesity and type 2 diabetes, or blood pressure and cholesterol management, often necessary to manage coexisting conditions. Lifestyle changes like diet and exercise and weight management are helpful as well.
Okay, Danielle, now I'm going to ask you a few NCLEX questions over type 2 diabetes. Okay, so first question is going to be, a nurse is reviewing the medical record of a client with type 2 diabetes. Which of the following findings should the nurse identify as a risk factor for developing complications? A, fasting blood glucose level of 115, hemoglobin A1C of 9.2%, that was B. C would be blood pressure of 122/78, or D, HDL cholesterol of 65. What is the answer?
It is B. Hemoglobin at A1C of 9.2 indicates poor blood glucose control, increasing the risk of long-term complications.
Okay, good job. A nurse, this is going to be the second question. A nurse is teaching a patient with type 2 diabetes about foot care. Which of the following statements indicates a need for further teaching? A, I will inspect my feet every day for cuts or blisters. B, I should walk around the house barefoot to keep my feet dry. C, I will trim my toenails straight across. Or D, I will wear clean cotton socks daily.
The answer is B, I should walk around the house barefoot to keep my feet dry. Walking barefoot increases the risk of injury, especially in patients with neuropathy.
Okay, good job. And here's question 3. A nurse is caring for a client newly diagnosed with type 2 diabetes. Which of the following medications should the nurse expect to administer? A, regular insulin. B, glipizide. C, NPH insulin. Or D, glycogen.
The answer is going to be B, glipizide. It's an oral sulfonylurea commonly used in managing type 2 diabetes and mellitus by stimulating insulin release.
Okay, great job. Okay, question 4. A nurse is providing dietary education to a patient with type 2 diabetes. Which of the following meals choices indicates a correct understanding of appropriate food selection? A, fried chicken, mashed potatoes, and a sweet tea. B, grilled salmon, brown rice, and steamed broccoli. C, a cheeseburger with french fries and a regular soda. Or D, a pepperoni pizza and some ice cream.
The answer is going to be B, grilled salmon, brown rice, and steamed broccoli. It's balanced with lean protein, whole grains, and a non-starchy vegetable.
Okay, great answer. Okay, and the last question is, the nurse is assisting a client with type 2 diabetes who reports dizziness, sweating, and tremors. Which of the following actions should the nurse take first? A, administer glycagon IM. B, give 4 ounces of orange juice. C, recheck the blood glucose in 30 minutes. Or D, notify the healthcare provider.
The answer is going to be B, give 4 ounces of orange juice because the patient is exhibiting signs of hypoglycemia. A fast-acting carbohydrate is the first line of treatment.
Okay, that's great. Well, that's all the information we have on type 2 diabetes.